Hi there. Just going to talk about the risk factors in adolescent sexuality. I think this topic is important to discuss as we are looking into the subject of hypersexuality in adolescents and how that could be an issue and how it's actually impacting the lives of adolescents. The textbook states and quotes early engagement in sexual intercourse, so that's prior to 14 years of age, is associated with high-risk sexual factors. And I think what they mean by sexual factors is sexual behavior, because they list a few things that I will mention. One of them is using substances while having sex, whether that's forced upon them or maybe they are consenting to using those substances, but then there's sexual behavior that might not be consensual after that. Another thing that they use, or that they say, is not using proper contraceptive methods. And so that increases the risk in adolescents for pregnancy and sexually transmitted diseases. And those can have lasting, lifelong effects. Another one is having multiple partners. Again, that increases the risk in adolescents for STIs. It also increases pregnancy if they're having more sex. And another risk factor that they mention is dating violence. Sex is a way that people use to control someone else in a relationship, and that can happen in adolescence, especially if they are viewing inappropriate content, maybe some pornography that encourages violent behavior. That could also be an issue. Lastly, what the book states is that adolescents are not emotionally prepared for sexual experiences, and I think that they're referring to the fact that adolescents' brains are not fully developed, and so they are experiencing something very intimate, very serious. Maybe they lost their virginity or something like that. They're in a committed relationship and that relationship fails. Well, that could be very heartbreaking. And or it's with someone that they don't really know. That can also be very hard to work through. And that could have lifelong effects because they're not mentally prepared to handle traumatic events like that.